Sally Sullivan with Sullivan Counseling in Oxford, Mississippi. Um, really, I just wanted to just kind of check the temperature on things locally. I know that obviously this pandemic has been a really difficult thing for a lot of people.
Yeah.
And so I'm kind of interested in doing a couple of things. One, I wanted to see how things are going for you from a professional perspective. What kind of differences are you seeing between in person and telehealth and things like that?
Well, I prefer person to person. Now, during this, when this first started, I was like, I probably need to go ahead and learn more about telehealth. So I went on and did that telehealth certification just to get
Okay.
that credentialing. Well, it gave me a lot of CEUs, and I figured there was probably a lot I needed to know, which was true. As far as how effective I think telehealth is versus face to face, I think it just depends on the situation.
Gotcha.
I prefer to come if they need to have an appointment once a week, then we're going to do it telehealth. Um, it's been stressful for me, professionally. Honestly, I think that I think it would be very unusual to find a provider that would say differently, because of all the variables that a lot of a lot of the times I will say to someone when they are struggling, well, let's reach out. Let's get you out. Let's get some behaviors changing. Let's go out. And all of a sudden you can't say that.
Yeah.
And so a lot of people who are highly anxious are even more anxious because they're in their head even more.
Right.
So some frustration for sure as things have become a little more lax. Of course, then we've seen the numbers increase. So it's very much a catch-22. Sometimes it's just a calculated effort, a calculated risk. Like I'm like, you really need to reach out to somebody, get a lawn chair and then get a lawn chair and just visit just something to have some contact. So it's been kind of think outside the box
Sure.
sometimes. But, not my preference, but, we don't get to choose.
Yeah, that's true. Well, good. So, I mean, it's all about making the best of the situation and, providing for people, and truly meeting people where they are. I mean, this is probably the best
Yeah.
example of that. And what would you say your specialties are, your specialty areas?
Do whatever.
So you like to see more females, more males,
Okay.
kids, family?
I'm, I'm struggling to hear you.
Oh.
I'm trying to find your lips. So yeah, you've got my good phone number. You've got my good phone number.
Okay, would you go ahead and say what that is? That way this can be part of the video?
Yeah, but I have moved. We moved offices.
Yeah, I kinda thought that. Where did you guys move to?
It's 2690 West Oxford Loop, Suite
Okay,
146. So it's like it's directly when I tell people that we've moved, I'm like it's directly behind Alpha Insurance, which is directly behind Home Goods.
I know exactly
So
what you're talking about.
yeah.
Yes. Okay, well, very good. Well, thank you. I appreciate this. You were
Well,
the first one, Sally.
that doesn't happen often. Thank you. Yes.
Well, thank
Hi.
you.
How
I
are
really wanna
you?
make sure people know what's out there and what's available, and I thought this might be a good way to do that.
Thank you, Karen. I'll
'Cause this
text you
this is
my good.
just about you, so I don't wanna make this about me.
Well, no, I want it to be about you because I don't do addiction. I need places that I can refer to. I'll text you my new address so
Okay,
you'll have it, and then you can send whatever.
that's perfect.
Perfect.
Sounds good.
Happy
Good to
Monday.
see
We'll talk
you.
soon.
All right, take care. Bye-bye.